What are D-SNPs and why should you care? Welcome to the CarePayments Pod. I'm Fadi Sahar, president of EXA Globex, and today we're discussing D-SNPs, one of the most important trends for integrated care for participants in LTSS. And with me is Mandy Sahar, the co-author of the BPP blog and DEHQ.
Hey, everybody. Really excited to be here for one of two podcasts covering this topic. I'm really excited to get started. So, Fadi, what are D-SNPs? Let's break it down. Dual eligible special needs plans.
So let's start with reminding everybody of who duals are. Dual eligible consumers are ones who are eligible for both Medicare and Medicaid. And so the D-SNP plans are specifically designed to address the needs of these individuals. And they come in a variety of shapes and sizes. The easiest way to think about them is they are a form of a Medicare Advantage plan. So a person who's eligible for Medicare, rather than getting a supplemental coverage or to get Medicaid directly from the state, they receive it from the same provider, and therefore they're able to have a single door to deliver their services rather than having to go to multiple providers. And as you think of it in that sense, they're a subset of different aspects of what D-SNPs provide for consumers. Specifically, the fact that the states have to have a special contracting structure with these providers. They're called SMACs. And SMAC stands for State Medicaid Agency Contracts. Now, we all know that these acronyms can be a challenge in and of themselves.
So many.
But the federal government actually requires those so that the state can designs its own Medicaid plans, can actually deliver the services in a way that meets a national standard while also customizing it for its own state's needs. And so these SMACs are the ones that define the range of eligibility, who's eligible for these D-SNPs, and how they can participate. And like we've said before, you've seen one Medicaid plan, you've seen one Medicaid plan.
Exactly. And, from all of our research, we're talking about D-SNPs and how fast they're growing, right? So over 5.2 million enrollees across the 45 United States plus DC, of course, in 851 D-SNPs. So there's so many people kind of packed into not that many spaces. 92% of duals live in a county where at least one D-SNP is available. And who are they, right? So they're individuals who have more likely to have a chronic illness, more likely to be admitted to the hospital, and more likely to be a person of color. And that's just the facts. So when we think about those types of facts, who can enroll to be in a D-SNP?
So, the who can enroll is defined by every state individually. So I'm going to try to talk about the different shapes of D-SNPs that might be available for consumers. So the first one that we can think about is a fully aligned, fully integrated D-SNP, where the consumer receives all their Medicaid services and their Medicare services from this one provider. Think of it as an MCO, a managed care organization that has responsibility for all the physical health as well as all the services being delivered in the community. A fully integrated plan sounds like the ideal world, right?
Right.
Unfortunately, we find that not all plans are 100% integrated. So they could be partial integration of Medicare and Medicaid. And the reason for that is states sometimes define populations where these particular needs are better met when they are integrated. So some of the states will look to include specific populations rather than include everybody. And so, or to include specific services, because sometimes the very high needs of a particular population make it very difficult to cover all those needs with a single provider. But you see that these plans have a very broad spectrum of reach. So they look a lot like a Medicare Advantage. But if you think we visited with earlier with a podcast about the PACE programs, where you
Mm-hmm.
have the all-inclusive services for the
Right.
elderly. And so that's a form where individuals who are in a PACE plan could have a partial D-SNP. And
Right.
they choose, the states make those choices. I know this sounds like very technical, but that's why I think D-SNPs create a complexity as well as a simplicity. They're the kinds of benefits that we would like to see applied to as many consumers as possible. So we would include their Part A plan, their Part B plan, their Part
Right.
D plans, but of a Medicare program. But we also need to acknowledge that there are financial risks associated with whoever is going to be running these programs.
Right. Medicaid, simple but complex. D-SNP, simple but complex, right? So, we talk about these things and we've written about them. We have so much in our VBP blog and our DEHQ on this topic. And we've talked about the importance of that alignment, right? D-SNPs being aligned with what's going on within the state and federal level. Can you explain a little bit deeper on that concept of alignment and why that's so important?
Yeah, it's a thank you. I think this is an area that we need to talk about a lot because alignment is the simplest way to do it is creating a program where some of our most vulnerable consumers who are eligible for the D-SNP are able to access all their services in a coordinated manner. We're going to spend a little more time talking about services coordination. But for purposes of this discussion, what I'd like you to think about is what would make a consumer's life easier? What would allow the consumer to flow through their care needs without having to go back and get reauthorizations, get new people who are going to be making decisions about them, creating that deferral. Oh, I'm not responsible to pay for this. You should go to somebody else. So alignment, when you have full alignment, you simplify those processes, and we now become able to tap into an organized system that vulnerable consumers can go through without having to be, negotiating with a whole set of payers and providers who are in the business of managing their own business. But
Yeah, I mean, just reducing those barriers, right? And alignment, reduction of barriers, it's all saying the same kind of thing, just making it easier to get the services they need.
right, and you think about it, when you have a D-SNP, you identify the kind of people who are eligible for it, and you build in provider networks, organizations that are designed to support those unique needs of that D-SNP. And so, this is setting us up for where we want to go next with this care coordination. We'll spend some more time on that in the next podcast.
Perfect. Yeah. So this was just one of two. So in the next podcast, we're going to address how coordination of care with D-SNPs and different types of D-SNPs and, really dig into those pieces a little bit further. We like to keep it short and sweet for the CarePayments Pod. So thank you all for being with us today. And as always,
Onward.
Check out Paying for Outcomes, the value-based revolution. The link is in the description here. You can also get it at vbpblog.com. The CarePayments Pod is brought to you by Extra Globex. Extra Globex is a strategic consulting firm that works with companies that are at an inflection point. We work with organizations to help manage that change and meet your goals. What is your challenge? Let us help take you onward. Link in the bio for a free consultation. Visit us at extraglobex.com.